My name is Dr. Jaqui Hughes. I'm based in Darwin at the Menzies School of Health Research. I'm an early career research fellow supported by the National Health and Medical Research Council. I've been lucky to be associated with funding from the National Health and Medical Research Council over 10 years. I'm a kidney specialist, so I've trained for many years as a doctor. My area of interest is understanding about chronic and end-stage kidney disease, the impact on Aboriginal and Torres Strait Islander peoples, and my goal is to completely obliterate this condition. My first experience of proper research was training in the hospital system, and so I was supervised and mentored in that environment. And I was really set up for research through my PhD supervisors at Menzies, who have had a long and strong track record in research, but they also understand about research that matters. Research is vital for me to be able to be the best doctor I can to serve my community. So one of the first things that I was really proud to be a part of in my PhD was just describing with detailed methodologies differences in body composition between Aboriginal and Torres Strait Islander people. I was able to show that there was a greater proportion of lean mass, so that is fat, plus the bits of us that aren't fat. So muscle is a big proportion of lean mass. And that was really important for me as a clinician in kidney disease, because obesity is a big driver of diabetes. So if we understand more about the framework of how our bodies work, it would give us better insights into advising the community on ways forward in health advancement. One of the extraordinary things that I've been able to achieve just in the last 12 months is working with the infectious diseases team at my hospital and also at Menzies. And we were able to show that by giving an antibiotic tablet, which is really cheap, like 20 cents a tablet, timed their dialysis 3 times a week, that's been life-saving, and it reduces hospital admissions and length of stay in hospital for melioidosis. So they also have a research translation tool, small videos to explain our health policy. My patients really value having clear and useful information which accompanies their health treatments and is completely underpinned by high-quality scientific research. So I would encourage people to think about whether that might be a job that might suit you. So think about the types of research out there that you might get involved with. So in some of my research I work with numbers and statistics, and I love that. Some of my research I work with words and communicating, and I love that. Some of my research I work with a team, which means I've got to be a good communicator, and I love that. So I think we've all got to understand what our skills are and how we can best work with people. People can enter into research at all different levels. You can be a community-based research assistant, and that might be a stepping pathway for you. I would encourage you all to interview your potential supervisors to make sure that you can understand what they can provide for you so that you can achieve your fullest potential in serving your community. I just would echo what my research community participants tell me. They want to see a workforce in research that reflects them and understands them, so that would be more participation of Aboriginal and Torres Strait Islander people at all levels of research, including research entry levels, but also at the highest scientific levels. So there really has to be a strong partnership in policy and transformation and releasing resources where that's necessary in order to create the health care environment is to provide equitable health care for all Australians today, but indefinitely into the future.